Okay, let's just dive right into this. Welcome to a journey deep inside your own biology. Today, we aren't just talking about general health. We're going to reveal the hidden operating system that governs human life. I want you to imagine, just for a moment, an invisible engine running constantly in the background of your body. A vast, intricate network shaping your deep sleep, your daily energy, your emotional resilience, and the very trajectory of how you age. This is the ultimate masterclass on human potential.
For decades, we've been taught to look at our bodies in, well, isolated pieces. We treat poor sleep as a brain problem, right? Poor digestion as a stomach problem, and chronic anxiety as a mood problem. But what if those aren't isolated issues at all? What if every single one of those symptoms is actually an interconnected clue? Today, we are going to completely decode the master switch that connects them all. In the medical literature, you'll see this referred to as the 10th cranial nerve, but its Latin root, vagus, actually translates to wanderer. It is literally the great wandering protector. Starting way deep down inside your brainstem, this massive neural superhighway wanders down through your neck, it wraps around your vocal cords, plugs directly into your heart and lungs, and then branches extensively throughout your entire gastrointestinal tract.
Section 1. The hidden operating system.
Think of your autonomic nervous system as a high-stakes game of biological tug-of-war. On one side, you've got the sympathetic nervous system. That's your body's gas pedal, driving the whole fight, flight, or freeze response. Now, that was designed to save you from a saber-toothed tiger back in the day. But in our modern world, we are constantly stuck in a state of chronic sympathetic overdrive. Then, on the other side, is the parasympathetic nervous system. This is the biological braking system, responsible for resting, digesting, and repairing. And the primary driver of this absolutely crucial braking system, you guessed it, the vagus nerve.
So what happens when this biological brake fails? Well, you don't just feel a little stressed out. You unleash a cascade of downstream chaos throughout your entire body. A poorly functioning parasympathetic response means your heart might beat irregularly, your breathing gets shallow, and your digestion just grinds to a halt. Because your body isn't going to waste precious energy digesting food if it thinks you're running for your life. And without that brake, the vagus nerve can no longer keep systemic inflammation in check, which we know is a key player in almost all chronic diseases. Every symptom here is a signal.
Section 2. The mind-body highway. We naturally assume the brain is the CEO, right? Just shouting orders down to the organs. But here is the number that completely rewrites our understanding of human biology: 80%. A massive 80% of the nerve fibers in the vagus nerve are actually afferent. And what that means is signals are traveling from your organs to your brain, not the other way around. Think about the implication of this for a second. Your gut, your lungs, and your heart are constantly sending sensory data upward, literally commanding your brain's emotional state and stress response. If your gut is inflamed, it sends an alarm signal straight up the vagus nerve, and your brain translates that signal into anxiety. You aren't just feeling nervous out of nowhere. Your organs are actually telling your brain that the environment isn't safe. I mean, this completely changes how you understand your own emotions.
Section 3. Decoding your vagal tone. So how do we measure this? The gold standard metric for checking the health, flexibility, and resilience of this hidden system is heart rate variability, or HRV. Now, you might think a healthy heart beats perfectly, like a metronome. But it doesn't. There should actually be slight variations in the exact milliseconds between each and every heartbeat. That variation is your nervous system rapidly adapting to your environment, speeding up just a little bit as you inhale and slowing down as you exhale.
A really specific metric of HRV called SDNN gives us what is essentially a live diagnostic dashboard of your nervous system. If your SDNN is under 30 milliseconds, this is a major clinical warning sign. It signals dangerous autonomic dysfunction. Basically, your body is locked in fight or flight and totally unable to adapt. On the flip side, a normal reading of 35 to 70 milliseconds indicates supreme stress resilience. High HRV means your vagus nerve is beautifully toned, allowing you to just instantly recover from stressors.
Section 4. Engineering a system reset.
Now, if your HRV is low and your system is in overdrive, are you just stuck that way? Absolutely not. Let's dive into the most accessible tool you have to manually reprogram your parasympathetic response, and that is your breath. But we're not just talking about taking a deep breath to calm down. No, this is literal mechanical engineering. By targeting 4 to 6 breaths per minute, actively expanding the diaphragm on the inhale, and really extending that exhale, you are physically massaging the vagus nerve right where it passes through your chest. This specific rhythm sends a mechanical signal of safety directly up that 80% afferent highway to your brainstem, which forces your heart rate to drop.
But breathwork isn't the only way in. The human ear actually hides a fascinating secret. It's the only place on the outside of the human body where the vagus nerve reaches the surface. It's called the auricular branch of the vagus nerve, or ABVN. This gives us an anatomical access point, right there on the skin, to physically hack the nervous system. Whether it's through targeted acupuncture, gentle massage, or clinical transcutaneous electrical stimulation, we can trace this signal directly. When you stimulate the cymba conchae of the ear, that electrical spark travels directly along the vagal afferent pathway, straight into the nucleus of the solitary tract, or NTS, right there in the medulla of the brainstem. You are literally dialing directly into the brain's command center for relaxation. It's wild.
And it turns out, a neck massage isn't just a spa luxury, it's a legitimate clinical intervention. Beyond the ear, standardized clinical massage acts as a biological brake. Since the vagus nerve travels right down the neck, applying light, rhythmic pressure and twisting strokes on the trapezius, the sternocleidomastoid in the neck, and those suboccipital muscles at the base of the skull, that can induce profound, measurable physiological relaxation. It's like a manual override for your stress response.
Section 5. The safety protocol. Of course, modulating a cranial nerve that controls your heart and lungs is not something to take lightly. We are looking at absolute contraindications here. For instance, for patients with surgically implanted vagus nerve stimulators for things like epilepsy or depression, therapeutic diathermy, which is a type of medical heat therapy, is strictly prohibited due to the severe risk of tissue damage. Furthermore, aggressive neck manipulation, like carotid sinus massage, should literally never be attempted outside of a clinical hospital setting. Why? Because it can trigger severe, dangerous drops in blood pressure and heart rate.
Because of this, practitioners really have to screen heavily. If you have cardiac arrhythmias, a pacemaker, a recent history of stroke, or if you're taking rate-limiting drugs like beta blockers, manual vagal therapies absolutely require medical clearance first. Even with implanted devices, patients must be monitored for sleep apnea because stimulation can sometimes unmask or worsen airway obstruction. You really must know your biological baseline before you start pulling any levers.
So the golden rule of any vagal intervention is super simple. Start low, go slow. If you apply deep, painful, high-pressure tissue massage to the neck, it's going to completely backfire. Pain is interpreted by the body as a threat, which will instantly trigger that exact sympathetic fight-or-flight panic response we are trying to avoid. Gentle touch and light pressure are really the only ways to whisper to the nervous system that it is finally safe to let its guard down.
Which brings us to our final revelation. We started this explainer by looking at isolated symptoms, poor sleep, stress, inflammation. But by decoding the vagus nerve, we've uncovered the hidden operating system that dictates how you recover, how you process emotion, and how your cells fend off disease. The implications here are just staggering. If you now hold the manual to your biological braking system and you know how to actively build your stress resilience, how will you use this to rewrite your trajectory of aging and unlock your true human potential? It's an incredible mystery just waiting for you to decode in your own life.